Okay, good morning, everybody. A very, very warm welcome to you, and thank you for taking time from your busy schedules to attend today's session, where we'll be talking about securing health, aged, and social services with Carlos Gomez Gallego from HP Aruba Networks, and we're very blessed to be joined by Carlos today, who I believe, Carlos, you've been around since the very beginning of wireless and wired networks.
Yeah, it's thanks, Dean. Great to be here. Certainly been in the industry for some time, from the inception of wireless, working at some startups overseas, and then starting my own company here in Australia, which subsequently got acquired by Aruba Networks in 2010. And the product that they acquired from our company is the product known as ClearPass, which hopefully some of you know and love and use. And that sort of kickstarted my career at Aruba, where I've been with them for over 10 years now, and currently based in Brisbane, Australia. And I'm the Chief Technology Officer for the Asia Pacific and Japan region.
Excellent, thank you. Before we get stuck into it, I will just go over a few housekeeping items. You should see a chat tab open. So if you're experiencing technical difficulties, please do put something in the chat tab. We'll do the best we can to help you out. And if you do have Q&A, feel free to put them in. It is just Carlos and myself. So I do apologize in advance if we don't catch your questions straight away. We will do what we can to answer your questions during the session today. Again, if we don't seem to grab them, we will follow up with the questions post today's session. This session is being recorded and you will be emailed a link afterwards. So before we go deep diving into health, aged, and social, let's talk about, Carlos, the underpinning of what makes all of this sing and dance.
Yeah, sure, absolutely. So, I want to start talking today about, the underpinnings of all of these use cases and all of these great things that we want to talk about and be able to leverage, because, it really does start with the network and the edge, as we like to call it, in terms of providing that, that platform that allows you to deploy new applications, for patient care, for nurses, for doctors, for whoever it may be. And we call that at Aruba the Aruba Edge Services Platform, or ESP for short. Now, as Dean alluded to in the introduction, I've been around the industry for a little while, but not as long as Aruba and not as long as Hewlett Packard Enterprise, who've really sort of been there to some extent from the inception of networking, both on the wired and the wireless side of things. And so Aruba ESP is really us bringing together sort of 20 to 30 years worth of our product development and innovation into a framework that is hopefully easier for our customers to understand, and something that they can plan not only their digital transformations as it relates to cybersecurity and other things, but really to try and focus on those outcomes around improved patient care and the like. So there are three main layers to the Aruba ESP framework. So at the foundation layer, we have the connect, and ultimately networking is about connecting things or users to applications or things to workloads. And that's where we have our series of connectivity options, be them switching, wireless, SD-WAN, even cellular technologies, or even low Earth orbit satellite technologies in the future maybe. So that's that physical layer where everything sort of connects in, and going not just at the edge, but at the access edge, but also into the aggregation layers and into distribution and the like. But fundamentally, that connect layer is where the first point of contact, if you like. And once you are connected via one of those different on-ramps, we want to make sure that we're effectively protecting the user, the device, and the data. And especially in healthcare, we know that it's a highly regulated environment. There's a lot of sensitive information, and so we want to make sure that we're really controlling who gets on the network, what devices they get onto the network with, and what they're able to do once they're on the network. And by the way, just because you successfully connect to the network, we shouldn't sort of forget about you. So in that protect layer, we're also doing a bit of continuous, monitoring and of the security posture, of the identity, of all of these security focused elements, both internally and through our partner ecosystem, to make sure that we're maintaining that security, throughout the duration of that session. And at the top layer is really, where a lot of the intelligence from a software perspective, from an analytics perspective, from a sort of a machine learning and AI perspective sits, that is able to look at the data that's coming from the connectivity layer, that's coming from the protect layer, and able to look at that with a performance lens, in terms of how is the network performing, from a security lens as well, in terms of, okay, do we have new information that we need to feed down to the protect layer? The integration with a myriad of partners, be it for identity, for security, for device management, for patient managers, Epic systems, all of these kinds of systems, and really try and provide insights to the IT organization around how to get ahead of potential issues that are coming, provide as many insights as we can about potential issues that arise, and continuously sort of feed that back, as I mentioned, either to the protect layer or to the connect layer, to ensure that you have that ongoing fast, reliable, secure connectivity, over which you can overlay the applications that ultimately you're wanting to deploy. Because again, let's face it, the whole reason the network exists is so that we can run our applications over it, whether they're applications that we use as humans, or whether they're applications that IoT devices are leveraging. So hopefully that gives a bit of an understanding of what's contained in the Aruba ESP platform. And again, even though it's a sort of new name and a new framework that we have, the technology underneath it is what we've been working on over the past 20 to 30 years. So let's move on to the next slide there.
That's interesting. It's interesting you say that, Carlos. Decades and decades and decades of intelligence and innovation has manifested itself into what is arguably a very simple and easy to understand model. And we will move on, because I think it's very, very applicable to move to the depth under which HP Aruba has invested in understanding the ecosystem and the industry that is health aged and social. Unlike many others, Aruba is a very open company, and as you've rightly said, you sit underneath and enable what is a snapshot of industry partnerships.
Yeah, absolutely. Look, no one vendor can do it all. I'm a firm believer in better together, as it were, and certainly in the space of IoT, increasingly is where we're seeing the need to really build not just partnerships from a business perspective with some of the logos that you see on there as well, but in, as you mentioned, developing some of those frameworks built on open standards and integration frameworks that allow us to, whether we do it directly, whether our partners do it, or whether our customers do it, provide integrations with, whatever technology partner they may have. Understanding that obviously Aruba operates globally, and we can't build a dedicated integration with every single IoT or medical device manufacturer out there, despite the many wishes. So the way to solve that problem is to build a framework that allows you to integrate these in with a sort of a no code kind of a approach. And you can see here, this is just a sample of some of the integrations that we have with ClearPass specifically, which is very much the brains of the security operation inside the Aruba ESP framework. And again, whether it's to do with identity, with security, with logging solutions, with hotspots and payments, whether for patient use, for potentially, or for guest use, messaging systems, all of those that you can see there. And as I mentioned, this is really just a subset of the integrations that we support. And again, the reason we can do this is because ClearPass is a very, very open and flexible solution that can enable the orchestration between Aruba's connect, secure, and analyze layers with all of these solutions, some of which are on-prem, some of which are in the cloud, and service a variety of different things. And the reason that it's important to have these integrations is because we understand that a deployment consists of lots and lots of different technology elements from lots and lots of different vendors. And through ClearPass and ESP, we're able to bring all of that stuff together to enable more automation and orchestration of not just a single event, like I authenticated and so I got onto the network, but being able to service chain a whole series of events based on one particular security event or a performance event or whatever that might be.
So let's get stuck into it then. Let's talk about some scenarios, Carlos, particularly around the health, social, and aged industries. So let's get into it. So first cab off the rank for today. Talk to me about how the ESP platform and how Aruba and how Aryon helps integrate, patient and guest and generally a stakeholder experience. I've got a few taglines here, but if you can share maybe a few stories of what you've seen and where the industry is going.
Yeah, absolutely. So, guest access is something very near and dear to my heart, given that that's where ClearPass was born initially in doing guest and BYOD solutions. And to be honest, kind of started the company out of frustration as a user of hotspots and guest access around the place. And so, we have been, doing guest access for a long, long time. And even though, every industry vertical has its differences, there are a lot of similarities in terms of, the desire to provide a simple and secure guest experience that not only helps the the guests, as it were, or the patients or the families of those patients, but can also really serve as a great recognition of the quality of the experience at a particular location. We all know how desperate people are to get guest Wi-Fi at the best of times, let alone if you're potentially sick or with your family, or the flip side of that, if you're having a baby and you want to share all your photos with people, or you've gotten well and better and you want to share that with people. So whether it's self-registration workflows through captive portals and the like, right through to much more sort of secure capabilities that we have these days, thanks to the advancement of Wi-Fi technology, as well as the advancement on sort of mobile devices and laptop operating systems. So, we can really provide a variety of solutions. And again, not just necessarily for patient care inside a facility, but, as perhaps in more regional locations where, there's a more community aspect to some of the facilities that are hosting events that's about health education and the like, or whatever that might be. There are a lot of ways to either onboard guests, contractors very, very easily individually, or potentially, provide solutions for being able to pre-register and onboard, tens or hundreds of people. We take a lot of care to try and make sure that the user experience is consistent, but understanding that an iPhone works differently to an Android, to a Windows laptop, to a Chromebook or whatever. And, we spend a lot of time behind the scenes, meticulously trying to test all of these different variants and the like, so that we provide not only a great user experience for the end user, but make sure that we also capturing and dealing with whatever regulatory environment there may be in terms of knowing who's on the network and the like. And then the additional part to that as well is, okay, well, once they're on the network, what do we allow them to do? Do we allow them to just have full access to everything? Do we control how much time they're connected for? How do we make sure that those guests, patients, or community members, whoever it might be, are not impacting on the same Wi-Fi network that is also used to deliver patient care that the doctors and nurses are using and the administrative staff are using to access patient records at all of those IoT devices, and again with ClearPass as the brains and that that ongoing connect, protect, and analyze capability of the ESP framework. We make sure that we're delivering the right experience for the guests, and not compromising the experience for the sort of core network.
It's an interesting dilemma you solve, because you really want to allow little Johnny to get onto the network and do what little Johnny wants to do, but you also don't want little Johnny to accidentally capitalize the entire network and potentially take down the clean room.
Yeah, look, absolutely, and there are plenty of controls built in directly to the ESP framework. I mean, you can have the Aruba ESP framework, do URL content filtering directly on the, directly from the Wi-Fi network and the like. So there are a lot of those kinds of controls that that you want to put in. Now, one thing that I will raise, and something that we're seeing again, not just in healthcare, but across the board, is when guest access started many moons ago, there's always been a desire to monetize it on the one hand, but also to really make it quite restrictive in terms of these, you can only access it for an hour, or you can only download 100 megabytes, or those sorts of things. And what we're really seeing is a change in that, saying, well, look, we're going to get you on the network, and we're not going to try and put as many restrictions on the length of the connectivity, and we're not going to try and necessarily charge you for that experience. Having said that, there are still plenty of hotels and hospitals and other locations that are still charging for Wi-Fi access, and maybe in a revenue stream for them. But certainly we're seeing a move away from that, or I'm seeing a move away from that at our customers around the world.
I think it goes without saying that Wi-Fi is now on Maslow's hierarchy of needs.
It's a utility, as our old CEO will say.
It is very much a utility, and I think keeping the airfare is quite important. It was interesting you mentioned what you mentioned a minute ago, Carlos, and moving to quality and location of care is also important. It seems a bit strange, but now with, I think, Wi-Fi 6 and the access points that are coming out now, a lot of them are now coming embedded with GPS chips, further enhancing things such as, when you've got I think one of the staff here call it a control-alt-delete moment. Where's the defibrillator when you need it? And also you combine that with, I know a lot of the organisations and customers we deal with have many challenges through the pandemic of staffing, not just inside the ICT sector, but nursing, doctors, specialists, due to the lockdown and isolation. We've been under tight immigration control, and as a consequence, quality of care is paramount. The customers in particularly in social and age, they can vote heavily with where they spend their time with the NDIS and NDIA choices available to them. How does Aruba and how does the ESP platform help allow the reduction of the overhead, but also still maintaining top quality care regardless of who you are and where you are?
Yeah, no, that's a great topic of discussion, and certainly an area that we've seen a huge explosion over the past couple of years. Basically, they say that necessity is the mother of innovation, right? And so one of the tenets of the ESP framework at that connectivity layer is that it doesn't sort of mandate that you have to be, physically within the same location, right? So, we've tended to try and bring people and devices to the network. And what we can do with Aruba ESP, and look, we've been doing this for a while at Aruba, just, never sort of called it a buzzword, as it would. Excuse me. But what we're trying to do at Aruba is, rather than try and bring all of these users and devices to a physical location, what if we can bring the network to the location where those users and things are? And what if we can leverage the availability of broadband, which here in Australia is obviously very widely available, as it is in most parts of the world, and leverage that as a connectivity fabric that allows us to connect, individuals or things, no matter where they physically are, be it in the same city, in the same state, or even in the same country, and essentially extend the hospital network out to where that user is, so that they're connecting using the same security controls and mechanisms as if they were physically inside that that location. And this sort of technology, which sort of comes under the umbrella of SD-WAN, which is obviously a very, very big topic at the moment. There's a lot of really tangible benefits to this, not just for, say, a work from home employee, be they permanent or be they sort of on a contractor basis, but also with the ability to sort of set up a pop-up location, in the matter of minutes, as it were, to and essentially, again, extend that hospital network out to wherever that location is. So you don't have to reconfigure all of your devices, be it laptops, computers, IoT devices, because they already are programmed to connect to the corporate network, as it were, right? All you're doing is bringing that corporate network out to where those users are. And so over the past couple of years, we've seen this technology used for pop-up COVID testing clinics initially, and then moving through to mass vaccination sites. There was a number of large sporting stadiums in the US where they offered their car parks essentially for these mass testing and vaccinations. And the car parks typically were just not covered with Wi-Fi, let alone with whatever the local hospital's Wi-Fi was. But by leveraging ESP and this on-ramp that just happens to be not physically at your building, it's sort of in the car park of the of the Dallas Cowboys stadium or whatever, and provided you've got that backhaul connectivity, which if you're at home, it's probably going to be your NBN connection. If you're at one of these pop-up clinics, it's likely going to be a 4G or a 5G mobile, backhaul, or perhaps, even a run that you get directly from the facility, via a standard sort of Ethernet cable and the like. So, with ESP, location is really it's not a construct of, or it's not a limitation in terms of, providing that same experience, security. And again, if there's a lot of people working from home now that are just accessing applications and having a user experience that IT has zero visibility of. So we really think that there's a great opportunity there, and we have a variety of different sort of access points, whether it's for just a single sort of user in a micro branch style form factor, or if it's a more larger sort of pop-up clinic or facility, inside a shopping mall or in a community center or in a car park. Obviously, we've got a whole wide range of different Aruba access points that all have this capability built in to onboard you to the SD-WAN fabric and ultimately to connect you to the applications of the healthcare organization.
So what I'm hearing, Carlos, is with an appropriate application stack supported by Aruba's ESP and integrated via Aryon. Don't let your current construct of what a hospital or a campus or a care facility or a service center looks like, don't let that limit you.
Absolutely not. With a good, resilient network, you're really able to, onboard a whole series of different use cases. As I said, whether you're using the hospital as an education facility, whether there's, collaboration with university and other, educational facilities or with local government, using it as community centers. At the end of the day, the flexibility that you get through ClearPass, talking to the ESP architecture, really enables you to deliver network services to enable any of those kinds of use cases, and as you mentioned, not sort of restrict it, not let the network dictate what you can and can't do. Rather, you tell it what to do, and it supports those use cases.
Well, it's so customer experience and quality is paramount. However, I will move because in this industry there is quite, and as you indicated, quite tightly regulated. Funding sources can be limited. A lot of the organisations in this sector are non-for-profit, are significantly funded by the government, and must deliver strong ROI, and also must keep a lid on their costs. So it's one thing to be able to generate a positive customer experience, and as a consumer myself, I've recently had the experience of going to see a specialist, and seeing a specialist is a stressful experience. The last thing you want to do is be late, not be able to find your way around, and already be stressed out. So knowing that the technology is readily available with GPS tracking inside access points to literally open an app on your phone and ensure that you can get to the right place at the right time in an unfamiliar territory when you're already stressed is a massive big tick as far as I'm concerned. How can Aruba do that, knowing that we are suffering high inflation at the moment? We've got to keep a lid on costs. What are we going to do?
Yeah, absolutely. So look, I think you touched on a couple of different areas there. So let's sort of continue on, I guess, with the location side of things. And so Aruba's been doing location services for some time, and we do that with a variety of different technologies, both with Wi-Fi and with Bluetooth Low Energy, which in particular Bluetooth Low Energy is very, very good for indoor wayfinding and indoor navigation. And so we have various healthcare organizations and across other verticals around the world that have integrated that technology into their sort of mobile application to allow for that sort of indoor navigation blue dot experience. And that's because Aruba access points have a variety of radios in them, not just the Wi-Fi radio. So I mentioned the Bluetooth Low Energy. They also support Zigbee, and they support a variety of other radio technologies through USB ports that we actually have inside access points as well, that are used for other proprietary radio technologies from certain IoT vendors. But you mentioned GPS chips, which is something that we've only just recently announced at Atmosphere, and all of our Wi-Fi 6E access points will now include a GPS chip in them. And you may say to yourself, well, what's the point of having a GPS chip inside an access point? And without going into all of the very nerdy technology aspects of it, one of the challenges that we've had with doing the really accurate indoor location and for other use cases, frankly, as well, is if you've got a hospital and you've got 1,000 access points, let's say, in your environment, placing all of those onto floor maps in our administration GUIs and making sure that is accurate is a very challenging thing. And if you misplace an icon of an access point, let's say by a couple of centimeters on your floor map, that actually may result in a few meters of difference in terms of where that access point really is. And so, aside from the fact of having to manually place 1,000 access points or 500 or whatever it is, the accuracy, because you're kind of doing it just with your sort of eye test, can result in essentially, your frame of reference being not accurate to begin with, right? And so by having a GPS chip in our access points, we're able to actually establish a much more accurate frame of reference. And so in that example of 1,000 access points, and we demonstrated this at Atmosphere Live on stage just a few weeks ago, you might only have to place on that map, say 4 or 5 access points with the GPS chips in them that will essentially serve as anchor access points, and they will lock into a GPS signal and provide a highly, highly accurate, sort of XY location, in time and space. And then with those frames of reference, the Aruba software inside Aruba Central, Aruba ESP, will automatically place all of those other 994 APs onto your maps automatically and with a precise location. So what that means now is that you've got a very, very accurate point of reference to start actually measuring client location and provide, not just wayfinding, but also we see in hospitals a lot of customers using this for asset tracking of particular, whether it's wheelchairs, whether it's particularly specialized, medical equipment and the like. But the key to sort of accurate location is having an accurate point of reference. So let me just pause there to see if there's any other question on location before we sort of dive a little bit more into ROI.
We do have a question that's been sitting about where wayfinding and asset tracking is moving. So, in terms of the future, where does the future of wayfinding and asset tracking, what does it look like, the way that you see it, or the way that you've seen it integrated, across the region or the globe?
Yeah, so it's a very timely question, and I would certainly encourage the attendees, and we'll make sure that we get this link to them, to a couple of presentations and sessions that we ran through Atmosphere specific on this topic, because it sort of goes into it in a lot deeper. But let me try and I guess summarize or give you the abridged version. So as I mentioned, doing location with RF technologies can be challenging, right? Because of interference, because of the placement of APs, all of those sorts of things that I discussed. And so, what Aruba has done, and what we announced, is actually an initiative called Open Locate, which we are providing as a open standard to the industry, so that this same capability that we've built by leveraging GPS chips, as well as a couple of other technologies inherent in the Wi-Fi standards, can be leveraged by not only infrastructure vendors such as ourselves, but leveraged more importantly by our ecosystem of partners that actually develop the applications that do the mapping and that find a conference room or a wheelchair or whatever that might be. And so our hope is that as an industry, if we're able to provide highly accurate information that combines a series of technologies from multiple radio types and from GPS and other sources, we deliver a more consistent we deliver more consistent location information to the application and IoT vendors to build all of these great applications and things that can leverage that accurate location information. And so I think the underpinning of that is that accurate location information is very difficult to do with a single technology approach. It requires a combination of technologies, and that's why we're building more of these capabilities into our access points so that we can provide that more accurate information moving forward. And sorry, just to add, it's also important that we do it in a framework that is consistent with what the industry as a whole is doing. And GPS coordinates with their XY, with an XY kind of a framework, is something that every company today that builds location applications is familiar and consistent with. And so we want to deliver it in that same format so that it's very easy for our partners to build applications on top of Aruba infrastructure.
So that's fascinating in itself. If we combine that back with let's call it the new workplace, the new service center, the new care facility. Yep. With the open location and the GPS integration in the new access point devices, is it feasible? Do you see it's possible that the open location services could be used to provide better services in regional locations that may change? I know we at Aryon have customers that are challenged with differing locations where they provide services from time to time, and the limited IT support that's available is challenged in actually helping them on the spot.
Yeah, sure. Look, I mean, I think that there's obviously a difference between in terms of indoor location and navigating your way around a a sort of multi-floor, multi-building kind of a, campus or hospital or whatever, versus, just getting you to the front door of a location, right? And so, obviously GPS in particular is widely used today to get us to the front door, as it were. But once you're there, we're hoping that, imagine if you could effectively, type in a location into, say, Google Maps, like, patient ward 1312 at hospital, whatever. And not only would it give you sort of GPS directions to drive to the hospital and the parking space, but then actually give you accurate walking directions from your car to, to wherever that that patient ward may be. So that's the sort of thing that you can, if we're providing indoor location information in the same way that applications are already consuming it for outdoor GPS, then it should be a very natural kind of transition. So again, I think for any of those indoor location use cases, Open Locate, we really hope will build on what we're already doing, but with much more accurate information from the end user perspective. But again, from the administrator perspective, again, if you've got access points that are moving and you're able to sort of auto locate them and have accurate visibility of of who's at that location, what they're doing, what their experience is like. Location is also a really key component for user experience, right? We've all been in a situation where in one corner of the building you get great cellular or great Wi-Fi, and in the other corner you can't get anything, right? So having accurate location information also can help with troubleshooting of potential, dead spots and issues where there may be interference from a microwave in the staff kitchen.
So that's a double-edged benefit. It does improve that customer experience or the patient or guest experience, but also from a cost, we are on the keeping cost down. But from an administration overhead perspective, being able to use a cloud console to manage, effectively globally, that surely that keeps a lid on costs.
Yeah, absolutely. I mean, you bring up a great point. Aruba ESP is a cloud native solution that can be delivered and consumed directly as a service through through our partner Aryon, and can really provide a much more nimble approach to being able to deploy a new pop-up site if you need to, fix an issue, onboard a new application. And look, we saw this very much over the past couple of years where there was this sudden need to be able to, stand up a pop-up clinic or deploy certain capabilities. And people weren't physically allowed into locations because of COVID, right? And so, obviously, you still, if you're trying to deploy a switch or an access point, it sort of physically has to go somewhere and be sort of turned on and plugged in, as it were. But through a lot of the zero-touch provisioning that's built into Aruba Central and the fact that it's cloud managed, we actually had SEs from all over the world helping customers from all over the world as COVID sort of ravaged different parts of Europe and Asia and the Americas, to just get bodies on the floor and help people out. And really by having that Aruba Central manage that, we're able to provide a level of service and attention that you just simply can't do if you physically have to go to a particular location. So certainly there's a lot of cost savings in the sort of ongoing maintenance as well as the onboarding of a new location.
Yeah, it's interesting. You're right. Necessity is the mother of innovation. IT costs are expanding, staff costs are expanding. So now automating those repetitive tasks and being able to apply them with tight controls and quality, again, keeps those costs significantly lower. I've just noticed we're very tight on time, so I'm just going to skim ourselves through there, Carlos. So we've one thing I'd love to touch on before we move forward, though, is device visibility. I think it's quite an not a well-known capability as it relates to security, of knowing which devices are on the network, segmenting them, and giving them access to the right resources, but no more, no less.
Yeah, absolutely. Yeah, absolutely. Look, I think the user devices are fairly well known and understood. There's obviously different ways of doing it, but it's pretty understood how to securely get a Windows or a Mac laptop onto a network, right? IoT devices are a different story because oftentimes they don't have a user interface. They're not necessarily built with security in mind. There's a diversity of them. The IoT devices that get used in different countries, just within Asia Pacific region, vary very greatly. And so we need to find a way, unlike with let's say, your employees that are all inside a staff employee directory and the like, not all of your IoT devices that try to connect to the network are in some sort of asset register. We'd like them all to be, and so that they're all known. But there's often a need to connect something that the network has never seen before. So what we do with ClearPass Device Insights, which is built into Aruba Central, or you can leverage it through ClearPass on-prem, is the ability to provide that fingerprinting and classification of IoT devices as they connect onto the network, assess them for potential vulnerabilities, and provide the ability for you to automate certain onboarding workflows. So, for example, if you know that you have a particular manufacturer of a IoT medical device, you might craft a policy that says, okay, well, only if you classify as vendor X of medical widget Z, am I going to allow you onto the network, and I'll allow you with only limited capabilities to access the application server that you need to talk to, or a database, or whatever that might be. I'm not just going to give you blanket allow all because you provided because you've connected. I'm going to give you a very, very restricted role in terms of what you can and can't do. And so that allows us to not have to necessarily go and if you've got 100 of these devices, or 50, or however many it might be, it allows you to put in a way that as new devices may get unpacked and used and plugged in, a way for actually not having to necessarily deal with every single one of those devices. But more fundamentally than that, even if you have a much stricter policy that doesn't allow said device to connect, it's about visibility. If you can't see what's on your network, you have zero chance of being able to control it, give it the right experience, block it, and not just sort of block it naively, but also think, well, hold on, was this thing actually trying to do something untoward? Because if they've tried in this part of the network, maybe they'll try in another part of the network later. So it's not just about having a visibility so you can say yes or no. There's an additional layer on there of reconnaissance to some extent, to make sure that you're capturing everything that may have tried to compromise your network.
Equally, from a cost and I guess automation perspective, a typical network administrator scenario would be having a device like, let's say, a phone handset plug into a network somewhere. Not long ago, you would have to configure the port, configure the virtual local area network, et cetera, et cetera. It's actually an arduous task. Now, you would say to the user, just plug it in, give it a minute, you're up and running.
Simple. Yeah, absolutely. So it's the printers and VoIP phones, the original IoT devices, right? So one of the, whether it's the wired or the wireless network, Aruba ESP allows for exactly that scenario. You just plug the device in, if it's a wired device, obviously, or connect it to the Wi-Fi, provision it for the Wi-Fi if need be, and the network will understand what to do with that. Will segment the traffic that needs to be segmented, will restrict the access that needs to be restricted, and that can all be done programmatically, through ClearPass and some of our other technologies, so that the end users don't have friction. What we're trying to do here is eliminate the friction of the end users, whether they're obviously in this case, doctors, nurses, administrative staff that may be, connecting these IoT devices, whilst ensuring that we're, providing the security and the controls that, that protect the organization.
Very much so. We've spoken a lot about devices. Let's talk about how ESP brings this to life for the people, the biggest asset of the organisation. How can ESP make the stakeholder, be that employee, the guest, the patient, how can it make their life easier?
Yeah, well, look, I'm a big believer that every employee has to be part of the solution, not part of the problem. And it's increasingly difficult to have a smaller IT organization with more demands on them, deliver more, right? I mean, I know that it's the do less with more is commonly talked about, but it's sort of easier said than done. And that really is one of the key things that we're trying to do with Aruba ESP. It's not just targeted at the IT administrator. Aruba ESP is there to try and make the experience better. Yes, for the IT administrators and the security people involved, for the C-suite that that get great analytics and telemetry at a very, very high level in terms of the security posture, risk, compliance, all of those sorts of capabilities, and some of the numbers and costs as well through Aruba GreenLake. And as you mentioned, for the patients and the guests and the people that are expecting an experience that is akin to what they have at their home, right? Where they just connect to the network and it just works, right? It's challenging when you can provide, when people are used to a certain level of experience and that they say, well, hold on, I can do this at my home. Why can't I do this at a hospital? Don't you guys have a huge IT budget and experts and the like? And I know it's not as simple as that because there's a lot of nuance in enabling that sort of frictionless experience. But again, this is what we've tried to do over 20 years of R&D and rolling it into this sort of connect, protect, analyze layer of ESP, and trying to be, program the network so that it works for the constituents. And I think a big part of that is empowering the users so that it's a more self-service kind of a model, and they're empowered to connect a new IoT device, to register for guest access, to stand up a new pop-up clinic, or whatever it might be. Now, I'm not saying that and all of that has to be done with a great audit trail and defined controls. But I think that's that's a key tenet to try and empower the users to think of the network as an asset for them versus something that gets in the way of them delivering patient care.
That's very well said. So delivering a secure, low overhead network with a frictionless experience for the people who need to consume it.
Yeah.
Very well said.
Absolutely. And yeah.
So let's just wrap all this into one. And I think you mentioned one thing that we've skimmed through this entire time. You mentioned a bit of an interesting word that will probably make absolutely no sense to anybody else on this session except for you or I. It's a word, GreenLake. Expand for me. Why is GreenLake a thing? And talk to me about the evolution of the network and how you see that.
Yeah, sure. So GreenLake is the sort of HPE solution that provides everything we do from a compute, storage, or networking delivered as a service with a series of financial and consumption models. And GreenLake for Aruba is the sort of networking component of that, where all of these great things that we've sort of discussed and all these possible use cases, you might think, okay, that's great. I don't have the IT staff to support it. I'm not sure if I can afford it. And I'm not sure if I can sort of manage the ongoing because I'm focused on this line of business applications. And so, what Antonio Neri, our CEO, committed 2.5 years ago to deliver the entire HP portfolio as a service. And we announced just a couple of weeks ago that all of that is now running under a common platform known as GreenLake. And it allows our customers to consume the network as a service, allows them to scale up and scale down as their needs and may vary, and ultimately allows them to focus on as I said, patient care and outcomes and line of business applications. I use an analogy that hopefully will resonate with people. So it was only maybe 5, 6, 7 years ago tops that we were all managing Microsoft Exchange servers, and depending on the size of your organization, you may have had 2 servers, 3, 4. You may have had other technology to do spam filtering and security and a high performance MTA. And today, you wouldn't even think about managing a Microsoft Exchange server. You just consume that from Office 365 or from Google and their G Suite. And so we're kind of seeing some of the network functions and the applications gradually sort of move in this direction, because some of the fundamentals, some of the repetitive tasks of networking, some of the challenges, that's our bread and butter. We do this every day, and with our partner Aryon as well. And so we're seeing a shift where customers are going to look to start consuming the network as a service as they do their email and office and file and print services, and be able to not have to worry about that and dedicate their people to enabling the applications over the top of that infrastructure. So we've got plenty more information of that, but we can share. That was just a high level overview. But GreenLake is really about taking away the busy time that it takes to sort of manage the network, do that for you, and let you focus on those business outcomes.
Yeah, very much so, Carlos. We're seeing the same thing. We're seeing customers want to enable the capabilities, and they want to consume and provide that improved experience, but facilitating it has always been a challenge, and I applaud HP Aruba for GreenLake and for facilitating, particularly in Australia, in this lovely state Queensland, the ability to be able to consume the network as a service, so that the organisation themselves can focus on what they do best, which is delivering the care and enabling that through the application side of it. We are right on edge. We do have 2 use cases we were going to go through, but I think in the essence of time, let's make them fairly quick. I think we've covered them off through our conversation today. I just want to bring to the light in these scenarios. It's pretty important to really see and experience how the network has transformed and what capabilities it's now delivering that 5, 6 years ago was just a pipe dream. So I think this slide speaks very much to preemptive planning as it relates to space utilization and location tracing. And I think Carlos, you've not just touched on it, but also expanded in the multifaceted approach that Aruba's been able to take, and openly. So working with others, not just proprietary, but openly, to enable RF, BLE, all these terms, GPS and others to combine to enable this capability. So 30 seconds. Have you seen this used elsewhere now, in country, overseas?
We have had customers that have used this workplace insights for sort of contact tracing and space utilization, here in Australia, in the States, and even here locally in Australia, we actually had customers that were using this and were able to do enterprise contact tracing at the height of the pandemic, before there was a vaccine, and help isolate people. And a large part of this was because the employee had forgotten that they'd gone to level 2 to go into a room to access a resource. It was nothing malicious. It's just that computers have a better memory than humans, for the most part. So yeah. And the great thing about this as well is that customers that had the Aruba infrastructure and ESP in play were able to sort of leverage this immediately by just simply deploying asset tags and strapping them to either to assets or or to people through a key fob and the like. So yeah, it's great use case.
And that's exactly what I like about this, is that the capability is already there. So once it's brought to market by Aruba, if you are a consumer of this technology, it's pretty much already there for you to use. So there's not a massive investment to bring yourself into this capability. And I think the last one here was just a bit of a snapshot into how the ESP platform can be leveraged regardless of where you are, and also pointing to many different scenarios. So whether you're at home, so recently we've seen a massive economic challenge with the isolation regulations. It's brought many organisations to their knees, and I think is not very well reported. However, with this technology in place, I think you joked to me earlier, I'll just take a wrap with you. Most people don't even know what a wrap is, but
yeah,
you know, you can take it with you like you would a little packet and take it home, and all of a sudden you're in the office at home, securely, access to the right services. Your devices are getting profiled, so they can't get on if they shouldn't, and if they should, they could. It makes life so easy for a user.
Yeah, absolutely. So, look, we did touch on that briefly when we were talking about sort of taking the physical location out of the equation through Aruba ESP, and RAP, for those in the audience, stands for Remote Access Point, which is the name that we used about 10 years ago when we invented this technology, before SD-WAN was a actual buzzword. But the RAP, as we call it, is sort of, our original play on SD-WAN. Now, fast forward to today, and the entire ESP framework is built with SD-WAN Fabric as one of the tenants, either connecting different locations or connecting, edge workers that are sitting at home or in a serviced office, or whatever that might be. And one of the other advantages that we didn't touch on with regards to this remote access technology and being able to leverage broadband connections, mobile connections, whatever, is that you're not sharing that secure connectivity with your kids that are messing around on YouTube and gaming sites and doing their things, and the family watching Netflix or whatever that might be. You've really got a secure and segmented connection that goes from your device through the Wi-Fi of the Aruba AP, from through the internet, back to to wherever it needs to go, whether that's a public cloud application or a private application inside your data center. So really great security when you're sharing a home with other people that are not employed by your same employer, or shouldn't sort of necessarily have access to those same tools.
I mean, we could talk for hours on the scenarios. I know we'll wrap up. So even here, health assessments, touchless reservations, digital badging, innovation is just, I shouldn't say so much easier when it's underpinned by this platform, the ESP platform, but it really is. And I know the pandemic has been very tough, but as you've said, necessity has been the mother of this innovation. And Carlos, I just, as we wrap up today, big thank you for your efforts today. I know with your role, it's a big ask to take an hour out of your day. So for everyone on today's session, Carlos, thank you. And we've got 2 minutes, please. You are a big supporter of this industry, and I believe you're on your way to a rally of sorts shortly in support of raising money for cancer awareness.
Yeah, absolutely. I think most of us in the world have been touched by somebody that's suffered from cancer, and I myself am a cancer survivor from as of 5 years ago, clean, which is great. But next week I'm doing a rally for 3,500 kilometers, 6 nights and 7 days through the outback of Australia. Raising money for cancer awareness. With the entity that we're working with has raised over $25 million, I think, over the past 20 years or so. And I think this year's rally is raising around about $2.5 million to go to cancer research and the like. So this time next week, I'll be huddled inside a 2-door, very small 2005 Holden Astra, driving on dirt roads through the outback, hoping to survive and be able to do another webinar with Aryon and Dean in the near future.
Mate, good on you. Thank you very much, Carlos. If anyone's on this call and would like to support the charity, please get in touch with us. We'll find a way to support the cause. Thank you again. Everyone enjoy your day. Thank you.
Cheers, Dean. Thanks.
Thank you.